want to bring in the American Cancer Society's Chief Scientific Officer, Dr. William Dahut. Doctor, thank you so much for joining.
Yeah, thanks so much for having me today.
It is the final day of Breast Cancer Awareness Month as October comes to a close. What are the messages that you hope women take away from this month?
Well, I think we've made great strides in breast cancer treatment over the last 20 or 30 years. Breast cancer mortality has fallen by about 44%. So thinking of the thousands and thousands of fewer women have actually died from the disease. So really important to know your own individual risk for breast cancer. We recommend people talking to their doctors certainly at age 40, but some women probably should be screened earlier. And we're a little bit concerned about some populations, particularly women from Asian backgrounds who are seeing an increased risk in breast cancer under the age of 50.
Interesting. I want you to talk to me more about why these screenings are so important in the process.
So cancer is much easier to treat when we find it earlier on. And we really think that that's the main reason why we've seen so many fewer women actually dying from the disease. The treatment is easier, the outcomes are better, and women are much more likely to live a really normal and productive life.
Mm-hmm. Do you think women should start screening for breast cancer at age 40, or would you recommend earlier?
I think what we'd really like to get to is a way where really screening is actually much more personalized or precision-based. We really know if you have a family history, or if you have a history of dense breast, or if you have an inherited mutation such as the BRCA gene, you probably should be screened earlier on.
Mm-hmm.
And we really like to really empower women to know their own individual risk, so they should know better when they should start screening. Probably some women should start screening actually in their 20s.
Mm-hmm. And I do think that some insurance providers, some insurers that is, actually do cover those screenings at a younger age than just 40 years old. I know, Doctor, the American Cancer Society just released a major new report for Breast Cancer Awareness Month. What were some of the findings there?
Yeah, so I think one of the most important findings, we talked about the continued improvement of overall mortality, the fact that there are certainly many fewer women dying from the disease. But again, I think what we're seeing concern in breast cancer, as we've seen in other cancers, an increased risk for women under the age 50 developing cancer.
Interesting. I want to talk more about that, how younger people are seeing this more often than what we had seen in the past. What's behind that?
Yeah, it's a little complicated. A lot of the cancers that we're seeing an increased risk appear to be related to diet and potentially obesity. And so that's certainly one thing we're thinking about. Although we don't actually have the proverbial smoking gun. One thing I think it's really important for women to know is that if they really sense something abnormal, something doesn't feel right, that they really need to be sure to advocate for themselves. Mm-hmm. And if someone tells them you're too young, or it's part of your medicine cycle and doesn't feel right, make sure you see somebody else, because that's sadly not often the case.
Such good insight there, Doctor. I'm glad that you were able to share that with us. I do want to turn to prostate cancer. Of course, our bell ringer here at the Stock Exchange, Fans for the Cure, as our viewers might see behind me, is set to take the podium. Is screening for this type of cancer important?
I think it really is. I think prostate cancer, if we look back, again, about 30 years ago to now, we've actually decreased cancer mortality from prostate cancer by about 50%. And like breast cancer, we know with prostate cancer, if you find it earlier on, it can be much more easily treated, and often people can have a very normal life. Mm-hmm. One thing also about when you find it earlier on, there are often a lot of men whose cancer can be really safely watched, and they actually never need to be treated, or we can intervene when we see cancer progressing.
What are some of the misconceptions about prostate cancer and even prostate cancer screening?
So I think the number one misconception about prostate cancer is how one screens. Really, the test that is done is really a simple blood test to tell you your risk of it. If you have symptoms or pain, then yes, a digital rectal exam would be part of the examination. But for most people, and they should talk to their doctors before they have the test, simply a blood test, what's called a prostate-specific antigen, a PSA test, will tell them what their risk is of prostate cancer. So I think that it's much easier to be screened than I think people may think.
Dr. William Dahut, Chief Scientific Officer at the American Cancer Society. Doctor, thank you so much.
Yeah, thanks so much for having me on today.